Today, when we speak on virus, the deadly coronavirus or COVID-19 comes to mind. But we're forgetting. There's a silent swarming virus that has been on the rise in Malaysia, and that is the equally deadly dengue virus. The dengue menace has long been a serious issue, not only in Malaysia, but also the world. In fact, it is a matter that has long remained unsolved. So why is that despite the efforts to combat the deadly Aedes mosquito, the number of dengue fever cases remains high every year? It is not only in Malaysia. The global incidence of dengue has grown dramatically in recent decades, putting half of the world's population at risk. So here's another episode of Pulse, and this time giving you insights in the serious problem of dengue.
At a glance, the reduction of 16,454 cases is good news for us. However, the number of dengue cases has not come down steadily since the beginning of May.
Kementerian menjangkakan akan berlaku peningkatan kes demam denggi gelombang kedua bermula awal Jun sehingga September 2020, iaitu berdasarkan trend kes demam denggi selama 5 tahun.
WHO estimates there are 100 to 400 million dengue infections globally each year. They came out with a global strategy and integrated vector management.
So WHO have been advocating this idea. Integrated vector control management means two. Number one, to consider the entire life cycle of the vector, and number two, to focus on not only the health response but also non-health sector ataupun environmental sector. This includes town planning, urban design, environmental health, local city council, and cleanliness. I think Malaysia is among the early country in the region that adopt integrated vector control management.
In Malaysia, the main agency in charge of controlling dengue falls on the shoulders of the Ministry of Health. As Tan Sri Dr. Nur Hisham said, to reduce the burden of dengue in the country, the ministry had implemented various prevention and control activities at a national, state, and district level.
In terms of national level, we have what we call dengue task force meeting. This involves 8 ministries, 8 other ministries such as Kementerian such as KPKT, Kementerian Perumahan dan Kerajaan Tempatan, the Army Force, the Police Force, the Multimedia Ministry, and Education Ministry. All this, help us to for example, for KPKT, they can provide us help in terms of dengue control. For education ministry, they can help us with education for the school children. For KL, for example, we have this what we call dengue patrol schools. So we educate them about dengue and how to prevent dengue.
The vector unit in each district health office carries out vector control and prevention activities daily, including on weekends. Vector control includes search and destroy, larviciding, and fogging. Meanwhile, vector prevention involves search and destroy and larviciding. Apart from these conventional methods, there are also new innovative measures introduced for vector control and prevention management. Usually, when an outbreak happens, we'll wait for the authorities to fog the area. However, this is too late because the adult mosquitoes are already flying and biting people. This is where artificial intelligence steps in. Artificial Intelligence for Medical Epidemiology, or AIME, is a dengue outbreak prediction platform which provides a more focused and real-time notification.
So this is how we use artificial intelligence to predict mosquito behavior and to predict where they're going to lay their eggs, and therefore we know where the outbreak will happen next. And the idea why we use AI is to close this gap, the one that I mentioned to you, right? The gap of knowing about the mosquito before it become a mosquito. Now, what predictive capability will offer you is the fact that it know the phenomena, or it predict the phenomena before it become a fire.
The purpose of AIME's predictive surveillance is to identify where the larvae is and stop it at its track of progression, because the adult mosquito can become very resistant to insecticide. Therefore, we need to start investing away from fogging and control to active predictive surveillance.
Besides the active predictive surveillance, another new direction in vector control is the Wolbachia project.
So what this Wolbachia do? We found out that this Wolbachia bacteria, they block the replication of dengue virus inside the mosquito. So with Wolbachia, there will be no dengue virus in this Aedes mosquito.
The Wolbachia project involves releasing Wolbachia-injected male and female mosquitoes into hotspot areas to mate with the wild Aedes mosquito, which then will replace and suppress the wild Aedes population. Prevention remains the most important action to reduce the risk of infections, as there are no specific medications to treat the disease. Although the dengue fever usually heals 3 to 7 days, it can sometimes lead to life-threatening consequences. The most common symptom of dengue is fever, followed by several warning signs.
Okay, the 7th warning sign usually would include the vomiting, the diarrhea, the epigastric pain, and then also tired. We call it lethargic, very tired. You cannot move here and there, or very tired, or cannot walk to toilet even, yeah? And then also we have this a very high concentration of hematocrit and very low platelet.
Usually, after the first few days of high fever, the temperature will come down as the immune system starts kicking in and clears the virus.
But it's not a time to rejoice, because this is a time when the antibody that our body produces interacts with the virus that is invaded in us already, and then that reaction might produce some kind of like collateral damage. Okay, and one of the collateral damage is the leakiness in the capillaries. Then the second thing is the bleeding. You know, the bleeding, they call it the dengue the mum dengue bordara. And that one is quite severe.
Theoretically, one can contract dengue 4 times in a lifetime, as there are 4 different serotypes of dengue virus circulating in Malaysia. Severe dengue is often associated with secondary infections.
If we get one infection to one serotype, then we are immune for life to that serotype. All right. But the problem is when we get it a second time, the first infection from the first serotype will come and interplay and with the second infection, and then the second infection becomes more severe.
It is during the critical phase that the antibody starts reacting, and that interaction will cause severe leakage and bleeding. The critical phase is very short. Patients could recover or die within a week.
I urge the public to come to hospital as soon as possible if they feel that there is a possibility of getting dengue, which you indicate by you have 3 days of fever, and then you have joint pain, bone pain. You can go to any not necessarily hospital, but you go to clinic to check first, you know, to screen for dengue. And dengue is preventable, and usually, actually we say treatable is more to like we support until the disease get off okay, and fully recover.
Early detection of severe dengue is crucial as it can reduce the dengue mortality. It also enables clinicians to make critical decisions and initiate drastic management to support the human body in curing itself.
People like to think about disease and medications as if it's the medications that cure the disease, but in a lot of viral diseases, similar with the COVID, the body immune system has to do the work, and in the case of dengue, the immune system will take care of itself. It is up to the body to do it. Okay, the virus is not like going to last forever. It's not like the HIV virus that will go on and on and on. No, this one, the immune system can handle it, but it's just that it takes time.
When it comes to dengue, people tend to focus and worry about the fever, and they will try to control it by taking medications such as paracetamol and ibuprofen. These medications will bring down the fever, but it will have detrimental side effects.
Sometimes the medication might make things worse, such as something as innocuous as paracetamol. We think that, oh, if we have fever, we pop in the paracetamol. But the studies have shown that actually the paracetamol can actually make the liver function worse. And severe liver disease is one of the hallmarks of severe dengue. So I would say be really careful about drugs. Really, I cannot tell you, even in adults, there's studies to show that adults. So we don't talk about even children.
At present, there's no specific drug treatment or vaccine for dengue. The first licensed dengue vaccine, Dengvaxia, was first licensed in Mexico in December 2015. However, it is not licensed in Malaysia.
So in order for this vaccine to work, you need to have a dengue infection first. You need to have one dengue infection, and then this vaccine might make your response a bit better. It will help your first infection will help the vaccine mount a better immune response. But then how do we know? You see, we don't know because a lot of us have silent infections. 75% of dengue infections are silent. So how? We don't know. So we have to do a test to find out whether we have a dengue infection before, and then get a vaccine. And then, it becomes very expensive to roll this out as a public health measure. So we didn't, I think that was one of the reasons. And then the second reason was most of these dengue trials were done in children. You see, because in the third world countries, the children were the ones who were at risk of the dengue infections. Unlike our country, we are seeing more adults, you see. So we don't know. No trials have been done in adults. So it kind of like, you can't take a vaccine that was studied in children and then expect the adults to behave in the same way. I don't think it's the same.
According to Tan Sri Dr. Nur Hisham, Malaysia has participated on the development of vaccine previously. However, as of today, there's no valid medical evidence on the effectiveness and safety of the vaccine to the public.
As there are no specific medications to treat the disease, prevention remains the most important action to reduce the risk of infection.
Dengue is endemic in this country, so we certainly would like to advise all Malaysians to make sure that we clean our home as well as our community. So, but because of the MCO, at least you can clean in terms of your home and your garden, for example. This is something that is doable. So we hope that continues. Just because of COVID, don't forget about dengue. Dengue is always there.
But while finding a cure or a vaccine remains a big question, our efforts now should be on prevention and control. As Tan Sri Dr. Nur Hisham advised, we should seek and destroy the larvae. After all, prevention is better than cure. Thank you for staying with us. We'll see you next time in another episode of Pulse, where we provide you pressing issues on health. I'm Camila Rizali. Remember, health is paramount.